Hello, Dr. James Bogash, expert in health longevity, and as a practicing chiropractor, this particular study is of particular interest, especially considering it interacts very heavily with something we offer in the office. And this had to do with whole body EMS. Picture a scuba suit, short arms, short legs, embedded with electrodes, and as you exercise, these electrodes help engage more muscle movement than you would otherwise do on your own. Really interesting. I think the sweet spot is really for people that are either frail, haven't exercised in a long time, or really are afraid to start moving, which can be a very common problem with people with chronic low back pain. It's fear avoidance behavior, and yet the best thing for people to do is to move. Sometimes they're afraid, so they need something or someone to help them. And this study was a small study. I believe this one was coming out of Germany, which is where most of the research on whole body EMS comes from. But it was 26 participants, age 40 to 78, and half of them did whole body EMS. The other half did typical exercise training, and followed it for 10 weeks, about 2.5 months. Before I tell you the interesting part, I will tell you that basically the outcomes were the same. Decrease in pain, quite a bit of decrease in disability. So people were far more functional, they were able to move and participate more in life as a result of both of these exercise programs, and had increased back muscle strength, a little bit more in the whole body EMS. But here's the real kicker, is the whole body EMS is 20 minutes a week versus 45 minutes a week. So half the time, more than half the time spent on whole body EMS had the similar outcomes as it did exercise training. As I mentioned, this is really kind of a sweet spot that for people that have chronic low back pain but are afraid to move, or really frail people. The real challenge, like in our office, is that there's a lot of people who really need this, but they're not looking for it because they have no idea that this technology exists, let alone how much it can add quality of life back into people's lives. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.